I applied what I've learned, from my own experience, which has to do with the way we triage patients, set priorities for the patients, as well as controlling the entire emergency room that tends to be pretty chaotic when a lot of people and a lot of patients gather together in a very short time period. So you have to make sure the system flows from the initial encounter until you send them either to the floor, the operating room, intensive care unit, or somewhere else. Well, the first thought I had, wow, in Boston, I've seen it in Tel Aviv, I've seen it in Jerusalem, but now I kind of was surprised to see it in Boston. And as far as the relationship, the U.S.-Israeli relationship in the trauma profession, they're very strong. First of all, I got a lot of emails and phone calls from colleagues in Israel asking if I need any help in any way or fashion. That's number one. Number two, regularly and routinely there are Israelis who attend the national American conferences. Many times they present papers, and some of them are very prominent surgeons who are well recognized by the US and the international trauma community. And during these sessions there's always exchange of information and knowledge. We disseminate what we know, they tell us what they know. So it's really a very productive professional cross-feeding that is taking place routinely. I can also tell you that in 3 years, 2009, 10, and 11, I was one of the organizers of the World Congress for the Advancement of Surgery in Israel, which of course took place in Israel, twice in Jerusalem and once in Tel Aviv. And during the sessions there was always trauma sessions, and we brought trauma experts from the US to Israel, and we had combined sessions with Israeli trauma leaders, which were very productive. In general, everybody applied some of the principles that were established by the Israeli surgeons and the Israeli trauma system. And this was very helpful here. The other thing is that I was very impressed with the response of our patients to their injuries. They gave us their determination, I think, their high spirits gave us, the caregivers, a lot of energy and inspired us to care for them. I also, really commend the fact that everybody was very quiet. Nobody really panicked, and people understand what's going on and acted appropriately. Most patients and all the caregivers, and I think Tufts Medical Center performed outstandingly to address the needs of all our patients.